Hi everyone. In today's clip, I will talk a little bit about GLP-1. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So GLP-1 or glucagon-like peptide 1 receptor agonist is a naturally occurring hormone produced in the small intestine after we eat. It plays a key role in helping the body release insulin when sugar levels are high. It only kicks in when there's enough sort of glucose, so it doesn't cause low blood sugar. Also, it helps in reducing another hormone called glucagon, and this stops the liver from making too much sugar and sending it into the blood. It also slows down how fast food the food is going to be leaving your stomach. This makes digestion slower and helps control blood sugar level after eating, and making you feel full sooner and for longer. It signals the brain to reduce hunger and appetite. So native GLP-1, which is produced in the intestines after eating, has a very short half-life, around 2 minutes, because it's rapidly degraded by an enzyme called DPP-4. Half-life refers to the time it takes for the concentration of a substance in the body to decrease by 50%. And for native GLP-1, after 2 minutes, only half of the original amount is going to be remaining active. So scientists then made medicines called GLP-1 receptor agonists, and these drugs act like natural GLP-1, but they stick around much longer, so they can keep helping body control blood sugar and appetite. Kind of like replacing a melting ice cube with a block of ice. That's going to last all day. The medicine does the same job as the natural hormone, but is for much longer time. These drugs bind to GLP-1 receptors in the pancreas, gut, and brain, producing effects like improved glycemic control, which boosts insulin, lower glucagon, weight loss because they reduce appetite and hence less food intake. And over the last few years, these medicines have become more and more popular. And some of the most common names that you have heard probably include Victoza, Saxenda, Trulicity, Ozempic, Wegovy, and more. Because of this growing interest, especially in weight loss, more people are starting on these drugs than ever before. However, not everyone can take GLP-1 receptor agonists safely. These medications can cause side effects and may be harmful for a certain group of people. Another safety concern is how GLP-1 receptor agonist interacts with other medicines, because they slow down how fast the food moves through the stomach. They can also impact or slow down the absorption of other drugs and nutrients taken by mouth. Most GLP-1 agonists are injected under the skin, and depending on the drug, injections may be needed daily or weekly, and some versions come in pill form and are taken by mouth once a day. Now, common side effects that are reported vary and are from nausea, vomiting, diarrhea, constipation, headache, fatigue, to muscle loss, osteoporosis, possible thoughts of suicide or self-harm. This is being investigated, of course. Pancreatitis, which is inflammation of pancreas, renal impairment or kidney disease, gallbladder disease, acute kidney injury, possible thyroid C-cell tumors, diabetic retinopathy, which is an eye disease that is caused by long-term high blood sugar, and it affects the blood vessels in the retina and can lead to vision loss if it's not treated. Now, diabetics have reported worsening of diabetic eye issues. and severe GI issues, just to name a few. So people who have a personal history of medullary thyroid carcinoma, or MTC, should never take GLP-1 receptor agonists. MTC is a rare but aggressive type of thyroid cancer that starts in the parafollicular C cells of the thyroid gland, and FDA actually has a black box warning on these medications. This is the strongest type of warning given for a prescription drug. People with multiple endocrine neoplasia syndrome type 2, which is called MEN2, should also avoid GLP-1 receptor agonists. MEN2 is an inherited disorder that causes tumors in hormone-producing glands, especially the thyroid and the adrenal glands. On the topic of GLP-1 and orthomolecular synergy, recent studies show that GLP-1 medicines may help your body absorb vitamin C better and keep your cells in healthy balance. Now, this fits well with the idea behind orthomolecular medicine, which focuses on using nutrients to restore health. Oxidative stress and micronutrient depletion, especially vitamin C, are central drivers of metabolic diseases. So GLP-1 drugs demonstrate that restoring metabolic flexibility reverses disease. Orthomolecular medicine aims to achieve the same outcome naturally and without the side effects. So orthomolecular therapy uses antioxidants such as vitamin C, vitamin E, selenium, zinc to reduce sort of oxidative stress, as well as improving insulin sensitivity and mitochondrial efficiency through the use of, let's say, omega-3 fatty acids, chromium, dietary optimization like low processed foods and carbs, nutrient-dense foods, detoxification, physical activity, micronutrient repletion like iron, calcium, vitamins A, C, D, K, B12, magnesium, zinc, selenium, protein, and last but not least, of course, probiotics. So GLP-1 drugs are seen as proof of concept pharmacology tools. We of course argue that this can be achieved without drugs, though, through nutrient repletion, as I mentioned, lifestyle correction, and detoxification without any side effects. Good health isn't about one drug, one vitamin, or one process. It's about keeping the whole body in balance, especially the way it handles energy and stress. Conditions like obesity, diabetes, and aging happen for many reasons, like toxins, poor nutrition, unhealthy eating habits, and we can fix this through natural approaches like good nutrition, lifestyle changes, and healthier, long-lasting way. So, for example, when vitamin C intake is minimal, the adrenal glands respond with a chronically increased release of cortisol in order to attempt to compensate for the decreased intercellular levels of vitamin C. Vitamin C and sugar look a lot alike into the body when they go in. When you eat a lot of sugar or a lot of vitamin C, your pancreas sends out insulin to help move them into your cells. But insulin can't tell the difference, so sugar and vitamin C fight for the same doorway into the cells. In diabetes, where sugar is always high, vitamin C can't get in. This leaves your cells starved of vitamin C, which is also why diabetes can cause so much damage. This is also the reason why mega doses of vitamin C is suggested at times we don't feel well, to ensure the level of vitamin C exceeds the amount of produced or ingested sugar. Now, because many tissues and organs have GLP-1 receptor site, there are many physiological effects beyond glucose metabolism and weight loss with this medication. GLP-1 receptor sites are also present in central nervous system, including hypothalamus, brainstem, heart, blood vessels, kidneys, and more. So all in all, I'm definitely in favor of keeping body healthy through natural ways, and try moderate exercise, proper nutrition, and fiber, as well as the fact that this beautifully designed body of ours knows exactly why it's producing the hormones that it is producing to the exact required amounts and with the exact life extension they need to have. Tampering with a well-oiled system like this is nothing but trouble. Every single thing in this system is related to each other. Nothing is dealt with in isolation. When you're trying something new that is going to interfere, increase, or decrease something, you need to definitely consider the impact on all the areas and not just the topic at hand. Hope this has been helpful. Like and follow for more. Be the light.